The numbers are stunning. Canada has already pre-ordered enough vaccine to inoculate every citizen nearly 6 times. And the U.S. has enough purchase options to vaccinate everyone nearly 5 times, leaving the rest of the world scrambling.
The Pfizer vaccine, the Moderna vaccine, the AstraZeneca Oxford vaccine, all the doses for this coming year have been claimed.
The hoarding, he says, must stop.
Australia, Canada, and Japan have less than 1% of the coronavirus cases, but they have more doses than all of Latin America and the Caribbean, which have close to 20%.
Who's the judge? Who gets to hammer the gavel and say, we've got to make this more equitable? Is there anyone?
There is no one.
Why does it matter?
Until everybody in the world is safe, no one is safe. This is a pandemic. If one country is left unvaccinated, this disease will bounce back and forth.
Dr. Larry Brilliant is a leading epidemiologist who helped eradicate smallpox.
So when Americans, and many of them feel this way, once I've gotten my vaccine, then we're good to go. There's no problem. We're completely protected. Is that true?
No, it couldn't be more wrong. First of all, you're going to have to wear a mask, practice social distancing, even after you're vaccinated, because there's so much we don't know about this disease.
Dr. Brilliant says vaccine nationalism could result in a tragic boomerang.
I can't think of an epidemic when that wasn't true. The rich push themselves to the front of the line. And it doesn't matter as much in anything as it does as an infectious disease, where being at the front of the line doesn't help you as much as making sure that everybody gets across the line. It comes out of desperation. It comes out of fear.
That's where COVAX comes in, a coalition of global health players, including the World Health Organization and UNICEF. The starting goal? Buy 2 billion doses of vaccine to inoculate 20% of the world's 100 or so poorest countries.
Is it fair to say that this is the greatest logistical undertaking in history?
It's the greatest logistical challenge that, on a scale we've not seen before in global public health.
Securing all those doses falls in Gian Gandhi's lap.
In order to get prepared for this, 1 billion syringes?
Yeah, 1 billion syringes, thousands of plane journeys from the factory gate to the ports of entry in every country. It is mind-boggling numbers.
But although they may have contracted for nearly 2 billion doses, at the moment, the cupboard is bare.
So you don't have your hands on them yet?
We don't have them yet.
Are the plans too ambitious?
No, it's not too big. In fact, it's too small. It doesn't have the funding and the resources that it needs. We need to have it in order to succeed.
The COVAX initiative right now has how much money in hand?
Around $2 billion.
And how much do you need to make it all happen?
Around $17 billion for everything.
There are a lot of people who say this is just way too expensive for America to get involved with.
This is way too expensive for America not to get involved with. How can we not afford the billions of dollars that will save the trillions of dollars?
And there could be other critical consequences as well. Frontline workers are needed to keep vulnerable populations around the world afloat.
If we don't vaccinate those frontline workers, we might see a resurgence of measles or polio that we were so close to eradicating.
This fragile ecosystem isn't protected. We could experience something even worse, the collapse of all the underpinnings that have supported these kids and their families.
Absolutely. No child and no individual is safe until everyone is safe.
So we do have a bit of what looks like very promising news. Sources have told NBC News that later today, COVAX will announce that it has secured some millions of doses of the Pfizer vaccine, so that much promised rollout will be able to begin very soon. It is a hopeful sign to the rest of the world, and we should take it as a hopeful sign as well. Back to you guys.
It truly is a global pandemic.
So glad Cynthia shined a light on that.
Gosh,
yeah, no idea. All right,
Thank you, Cynthia.
Thank you.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.